ब्लॉकेज म्हणजे हृदयाच्या रक्तवाहिन्यांमध्ये निर्माण होणारा अवरोध किंवा अडथळा. इट इज अ ऑब्स्टॅकल ऑफ द आर्टरीज विच सप्लाय द हार्ट. As our all the organs in the body require blood supply, by that they require oxygen and glucose. Heart muscle is basically a pump. It requires blood, and through blood it gets oxygen and the glucose supply. So there are three major arteries which supply the heart, and any obstruction in these arteries can lead to a heart attack or angina, a heart disease basically. So obstruction are of basically two types. One is cholesterol, which gets deposited over long time of duration and causes obstruction to the blood flow to the heart. This is cholesterol plaque obstruction, which usually gives rise to slow ongoing angina or exertional angina, which is a peculiarity of old age. Another type of obstruction is caused by the clotting of the blood, which we see in particularly in young individual when we get acute chest pain and a massive heart attack. So these are different type of obstruction. Although the treatment is different for the both categories, but what we see in young individual is obstruction by the blood clotting, sudden chest pain, sweating, and the patient collapses. Whereas there is no warning symptoms for this particular type of obstruction. Whereas where there is cholesterol obstruction which is accumulating over long time, usually gives some symptom. You get breathlessness on exertion, or you can get angina or chest discomfort on exertion. The obstruction caused by the cholesterol usually gives prolonged symptoms and mainly the exertional symptoms, whereas the obstruction caused by the blood clot are acute and catastrophic. So when you hear about a young heart attack, young patient going a heart attack, it's usually the blood clotting. And there are multiple factors which can cause blood clotting, including hereditary factors, some abnormality in the clotting mechanism, and the mechanism behind this type of clotting is the rupture of the plaque or acute rupture of the plaque, which is fissuring of the obstruction, which is very minor, which is not critical. Old age, you get exertional symptom and then patient develops a heart attack when the obstruction becomes complete. Of course, the add-on clotting on the cholesterol burden is an additional factor for the old age patients as well.